Hi, I'm Amy Mahaly from Be Well Clinic, and today we're going to talk about gallbladder flushes. Not what a gallbladder protocol is in specific, but an educational video about whether you should be doing a gallbladder flush, how to choose one, what to look for, and when is an appropriate time, meaning do you need one, and are you ready to do it? So keep watching because it's going to be very helpful. First, before we talk about gallbladder flushes, let's talk about the gallbladder. Gallbladder is a fluid or bile-filled sac on the outside of the liver. The liver is located in the upper right quadrant of your abdomen. The liver is a rich bed of capillaries. The blood flow going through our body slows down in the liver, and the liver can look at it and pull toxins out of the bloodstream and metabolize them and get them ready for removal from the body. The way that it does that is once it's pulled that toxin, it immediately puts it into the bile ducts in the liver to flow into the gallbladder, which then will flow into the small intestines through the distal bile duct going into the small intestines when you eat a fatty meal. Everyone knows about that. We all learned that in health class, but not a lot of people know that the toxins are in the bile. This is where gallstones come from. Toxins that have been encapsulated to protect the body because it's maybe caustic or it just is a better way to keep that toxin contained are present in the bile along with the bile itself, which is the emulsifier for fat. If there are a lot of stones in the gallbladder and you are not eating fat regularly, those gallstones start getting bigger and they can also get calcified. And a calcified large gallstone going through the bile duct when you finally do eat a fatty meal is what causes most gallbladder attacks. So let's avoid that. All of us want to keep our gallbladder. All of us don't want to be in that much pain. So let's make sure that we're keeping gallbladder health in our bodies. Okay, so we have a river of bile flowing, right? And then it either is a flowing river or maybe it has a lot of logs in it. Gallstones, right? Maybe it has a lot of logs and it gets sludgy and it's not going to move very fast even when you're eating fat. This is why we have fat digestion symptoms, meaning you eat a fatty meal and you feel nauseous or you get hiccups or you get heartburn. This is a sign that your gallbladder is full of large or small stones. We don't know. When that gallbladder is full, when the bile is sludgy, you're going to have symptoms, and this could be a time to do a gallbladder flush, but we need to be careful because if we do a gallbladder flush at that time, some of those stones might be large and calcified and actually hurt intensely, potentially, coming out. And you could end up in the hospital with a gallbladder attack and deciding about surgery or not. We want to avoid that. We know we need to eat fat for our body. If you don't know that yet, check out the videos on cholesterol in our channel. We know we need to eat fat, but what if you can't absorb it? What if your gallbladder isn't working well? So then we need to cleanse and flush our gallbladder out. But before you do a cleanse, do some prep work. This is the prep work that I recommend. First, start taking beet kvass, K-V-A-S-S, beet kvass regularly. This is a fermented beet beverage that helps break up the gallstones, even the ones that are already big. That is going to help make them small. It might take up to a couple months or more for those gallstones to be broken up, so be patient with this. Start with a small amount and work up. You can check out the recipe on our website. Once you've been doing beet kvass regularly, you might consider other things like lemon water, castor oil packs, potentially enemas, and eating progressively higher amounts of fat. So your body can get rid of what bile it can and the system can start flowing a little bit better. When you feel like you have a good handle on what your gallbladder can do and what your stone situation maybe is, and maybe bring in an expert in terms of a practitioner or someone to help you out if you feel like this might be an issue for you. Once you feel like you're in a good enough place, then we do the gallbladder flush. Then it's a let's get her cleaned out. It's usually a period of mostly fasting with a few different foods, and I'm specifically being vague here because this is not a protocol video demonstration. There's a few foods and some fasting, a lot of water, and you're basically giving your digestive system a rest while eating certain things that help your gallbladder excrete the bile stored in it to flush everything out. Find a protocol that does that. Find a protocol, usually about a 2, maybe 3-day protocol, but nothing long, nothing intense until you know what you're doing. Find a protocol where they talk to you about what to expect, when to slow down, when to stop, what uncomfort you might be experiencing versus things that are serious or scary. Those are the steps we want to go through when you find a protocol, and then follow that protocol, listening to your body. If possible, you want to finish the protocol, which is why it's important to choose one that's gentle, because we don't want to stop halfway through. But sometimes the body says, no, we need to prep more. We need to come back later. So make sure you're listening to your body as you're doing it. So in review, we know what a gallbladder is and how the bile got there. We know how stones have been formed. We know we need to get the stones out, and we need bile to absorb and digest, emulsify, and then absorb our fat. So we need bile to be flowing, and it cleanses our body. It does not matter how well your liver is doing its job if the toxins aren't getting all the way out. You're not going to be able to cleanse very much, and you will end up with backlogged problems. And we now also talked about what you look for in a gallbladder flush protocol and how to listen to your body. So I hope that all of that's helpful. Come back next time for more tips on how to care for your body, and make sure to keep watching our channel for more information about gallbladder, cholesterol, and other things like that.